So this is why you should never kiss a baby on the lips.
This is a result of somebody kissing her on the mouth. When parents say not to kiss their children, this is one of the reasons.
This is a recent photo of 8-year-old Breland. She was born healthy, but as a baby, she was kissed on the lips.
Man puts to bed, and you have a lot of visitors. People are coming to see you and see your baby. Of course, they want to carry your baby. They want to, kiss your baby. They want to, but don't allow people to kiss your baby on the lips, on the forehead, or even around the face. Yes. Most times, we parents can be sentimental. You don't want your visitors or your relatives to feel bad because you don't want them to touch your baby. But most times you have to consider the baby, the infant, because these children have lower immunity, especially infants within the first 3 months after birth. They have lower immunity. There's things that an adult can suffer and it will not cause problem, can cause severe problem to a child that is less than 1 year, or especially infant within the first 3 months of birth. So this is why a mother, after giving birth, you have the right to protect your baby. You have the right to protect your infants. You have the right to tell the visitor, please don't kiss my baby on the lips, don't kiss my baby on the forehead. You have the right. You don't need to be sentimental, because most times parents are sentimental. This my cousin, this my relative, this my sister, this my brother, the grandparents and all that. But you have to protect the interest of the baby. You have to look towards that. This is a child that is, the immunity is still low. And some of these children, some of them that are giving birth, preterm, they are at high risk of contacting infection that may be mild for adults, just like herpes. Herpes may cause some sores for adults, but when a child, catches that herpes infection, maybe through kissing, it can be very, very severe. When it spreads through the system, the organ, it can be deadly for the child. And there are certain bacteria that can even be harmful for the child, that can cause pneumonia, meningitis for the child. These are the reasons why you need to protect your child. And if your child is not immune against tuberculosis, that is the main reason why you need to protect the child. And remember, TB vaccine is given immediately after birth. So some hospital may delay. Sometimes when the child is preterm, they may say, okay, let the child be, you should go home and come back, at so and so time. So you as the mother need to protect your child until after, when your child is, when your child has been immunized. Even after immunization, your child is still at risk because their immunity is very low. What can be a minor symptom or a minor sickness for an adult can be a very severe sickness or can cause severe infection to an infant or to a child. So parents should be aware that you need to protect your newborn from adults and prevent them from kissing your baby on the lips, not even on the forehead, not on the cheeks, not anywhere. We need to create awareness. We need to make parents understand that it is very bad. Even you as a parent, you should not kiss your baby on the lips. Even you as the mother, you should not kiss your baby on the lips. You have the forehead, you have the cheeks to kiss your baby. Even you as the father, you should not kiss your baby on the lips. You have the forehead, you have the cheeks, not on the lips. I hope this helps somebody out there. Thank you and see you next time. Bye.